This following PowerPoint presentation is on physical exercise as a preventative or disease-modifying treatment of dementia. Dementia is a syndrome that is caused by continuous deterioration of memory, overall cognitive function, independence, and personality. It also causes a decline in physical activity, which can affect daily living activities such as cooking meals, getting dressed, or taking a shower. Dementia is more common in older people than younger people. Currently, there is no cure for dementia, and there is no proven medication to reduce the risk of dementia. An article published in October 2010 noted that there were 24.3 million people worldwide with dementia, and it is estimated that this will double to 81.1 million in 2040 because dementia is not curable. At the current time, research worldwide is exploring possibilities to delay the onset and development of dementia and other related mental illnesses. Physical exercise can be defined as a continuation of a physical activity for at least 20 to 30 minutes. It is often associated with health promotion initiatives, but recently, researchers have begun exploring if physical activity can contribute to healthy brain aging and if this could possibly be a protective factor against dementia and other cognitive impairments. Increasingly, studies are declaring physical activity a preventative to dementia when older. There has been evidence that long-term regular exercise is beneficial in reducing cognition and dementia risk. Adults who regularly played sport, exercised, or participated in any form of physical activity while in their midlife reportedly had significantly lower risk of dementia in their latter years. Several studies have also indicated that physical exercise improves cognitive function with people that have dementia. Exercise has been shown to be especially helpful in assisting with independent recovery of cognitive and behavioural functions of patients with dementia. The databases used for this assignment were Google Scholar and PubMed. The search term used to find journal articles were exercise, dementia, aerobic, anaerobic, resistance, training, treatment, and prevention. I linked words together like resistance, training, and dementia, anaerobic exercise and dementia, or exercise treatment dementia, and so on to find the relevant journal articles. 10 journal articles were included in this assignment to help give a detailed report. All of these journal articles have been published within 10 years of 2016 to help provide a current interpretation on the report and whether physical exercise could be used as a preventative or treatment for dementia. The articles used in this report suggest that physical activity could, in fact, be promoted as a treatment or a preventative for dementia without being biased. As it was mentioned earlier, there is no known cure for dementia, but exercising consistently in your latter years could reduce the risk of dementia. A study was conducted on 1,740 participants over the age of 65 who exercised at least 3 times a week. The goal was to see the risk of these people developing dementia in 6 years' time. Of the 1,740 participants, 1,185 remained dementia-free, with 158 developing dementia. 276 of the participants passed away and 121 withdrew. The results showed a reduced dementia risk of 32% when compared to the control group that didn't exercise at least 3 times a week. A study was conducted on people with dementia to determine if physical exercise could improve their gait. The participants suffered from mild to moderate dementia and took part in a 12-week program that consisted of 2 2-hour sessions per week. The focus was on high-intensity resistance and functional training. After completion of the 12-week program, the results showed a significant improvement. The high-intensity resistance and functional training improved temporal and spatial characteristics of gait with people who suffered from mild to moderate dementia. Another study was conducted with people that had senile dementia to investigate if physical activity could improve cognitive function. Subjects participated in exercise activities for 30 to 60 minutes, 2 to 3 times a week for 12 months. The results not only showed a significant increase in physical adaptations, but also in cognitive and functional activity. Despite limited studies focusing solely on resistance training and dementia, there are studies that have shown that resistance training may improve cognitive function. A recent study was conducted focusing on different combinations of physical activity and their effect on dementia. These activities focused on endurance, strength, and balance instead of focusing on either aerobic or anaerobic. The results revealed that patients with dementia had greater improvement in physical function compared to performing resistance training by itself, suggesting multi-component exercise could be more beneficial. An interesting study was done on combining cognitive activity with physical activity. Both groups performed 30 minutes of exercise, however the control group did not perform cognitive exercises whilst doing physical activity. The treatment group performed an additional 30 minutes of exercise 3 times a week whilst doing cognitive exercises. The program lasted 12 weeks. The results showed a significant improvement in balance, gait, and memory when combining cognitive activity with physical exercises, supporting the theory that combining these two activities together can increase memory function, balance, and gait for people with dementia. Another study investigating improving physical functions in the frail elderly with dementia focused on a multi-component exercise program. The program consisted of 4 weeks of walking, balance, and cognitive exercises, followed by another 4 weeks of resistance exercise programs. At the completion of the program, there was a significant improvement in all the strength exercises and physical function compared to baseline records. However, 24 weeks after the completion of the program, the subjects had lost their improved strength, balance, and gait. This reiterates that the dementia population should be involved in some form of exercise to improve physical function. Other results to determine whether physical activity can benefit or lower the risk of dementia have been mixed. Some studies say that physical activity is associated with the lower risk of dementia, whilst others report that there is no beneficial factors relating to physical activity to lower risk of mental cognitive impairments. In conclusion, research is now exploring physical activity as a possibility for prolonging the onset of dementia or as a treatment to improve physical and cognitive function for dementia sufferers. Most of the current studies are suggesting that physical activity can play a part in the delay of dementia or improve physical and mental functions of dementia sufferers. However, there is currently no definitive answer and more research needs to be done on this subject.